Opium's story is one of contrasts, from a revered medicine to a tool of exploitation and control. The British Empire's role in the Opium Wars marked a significant turning point, leading to widespread addiction in China and profound political and social consequences. As opium's use spread, so did its forms, evolving into more potent derivatives like morphine and heroin, each bringing its own set of challenges. Today, we face a new chapter in this ongoing saga with synthetic opioids like fentanyl, which are far more potent and deadly than their predecessors. The transition from ancient opium use to today's crisis reveals much about human nature, the pursuit of profit, and the unintended consequences of drug policies. Join us as we delve deep into the Opium Chronicles, a journey through time that connects the dots between ancient practices and modern dilemmas, providing a comprehensive understanding of one of history's most influential substances. Support Taboo History by subscribing, hitting the notification bell, liking video, and leaving your comment below. Our story begins in ancient China, around 3400 BCE, where the earliest records of opium cultivation are found. The plant, Papaver somniferum, known as the opium poppy, was initially grown for its seeds and medicinal properties. Ancient Chinese healers discovered that the latex sap extracted from unripe poppy seed pods had remarkable pain-relieving and sedative effects. This early use of opium was primarily medicinal, treating ailments ranging from physical pain to gastrointestinal disorders. As Chinese civilization flourished, so did the knowledge and use of opium. It became an integral part of traditional Chinese medicine, prescribed by healers and herbalists. The famous ancient Chinese medical text, the Shen Nong Ben Cao Jing, includes numerous references to opium's use in treating a variety of ailments, highlighting its significance in early Chinese medicine. Its use spread beyond China's borders, reaching ancient civilizations in the Middle East and Egypt, where it was equally revered for its therapeutic properties. Opium's journey from China to other ancient cultures highlights its universal appeal and utility. In Mesopotamia, around 3000 BCE, the Sumerians referred to the opium poppy as the joy plant, using it in religious ceremonies and for medicinal purposes. The knowledge of opium cultivation and use was passed to the Assyrians and Babylonians, who further refined its uses. They developed new methods of extraction and application, enhancing its potency and effectiveness. Opium became a valuable commodity in these regions, traded extensively and used in a variety of social and religious contexts. In Egypt, opium was a staple in medical treatments. The famous Eber's Papyrus, dating back to 1550 BCE, contains extensive references to opium as a remedy for various conditions. Egyptian priests and physicians valued it highly, and it became a crucial trade commodity, exchanged along the thriving trade routes connecting Africa, Asia, and Europe. Egyptian medical practices often involved opium as an analgesic, used to treat pain and induce sleep. The widespread use of opium in Egypt also contributed to its spread to other parts of the ancient world. As the Greek and Roman civilizations rose to prominence, opium continued to play a significant role. The Greeks learned about opium from the Egyptians and incorporated it into their medical practices. Hippocrates, the father of medicine, acknowledged opium's benefits, but also warned of its potential for abuse. He recommended its use in moderation, aware of the dangers of dependency. By the time of the Roman Empire, opium was widely used for its analgesic properties. Roman physicians like Galen praised its efficacy in treating a wide range of ailments, from headaches to melancholy. Opium was also used in surgical procedures as a powerful anesthetic, making it indispensable in Roman medicine. The spread of opium use throughout ancient civilizations set the stage for its complex legacy. While it was predominantly seen as a beneficial medicinal substance, the seeds of its darker side were sown. Over time, the potential for dependency and misuse became apparent, foreshadowing the challenges that would come in later centuries. The knowledge and use of opium were passed down through generations, becoming deeply ingrained in the medical traditions of many cultures. Opium's dual nature as both a healer and a potential source of harm is evident from its early history. In the ancient world, it was a symbol of medical advancement and human ingenuity. Yet, the stories of its misuse and the dependency it could cause were already beginning to surface. Beyond its medical uses, opium played a significant role in the cultural and economic landscapes of ancient societies. In China, opium was often depicted in art and literature, symbolizing both its medicinal properties and its more mystical aspects. Its trade routes became critical economic pathways, linking distant regions and facilitating cultural exchanges. The Silk Road, for instance, was not just a route for silk and spices but also for opium, which was traded along with other valuable commodities. In ancient Greece, opium's influence extended to mythology and religion. The poppy was associated with the Greek god of sleep, Hypnos, and the god of dreams, Morpheus. This association highlights the profound impact of opium on the human psyche and its revered status in ancient cultures. Similarly, in Rome, opium was not only a medical tool but also a substance that held social and religious significance. Despite its benefits, there were early warnings about the potential dangers of opium. Ancient texts and scholars occasionally noted the risks of excessive use. For example, Theophrastus, a student of Aristotle, wrote about the need for caution in opium use, hinting at an early understanding of its addictive potential. These early observations underscore the complex nature of opium, which was both revered and feared. As we move forward in our exploration of opium's history, we will see how these ancient uses and practices influenced later developments and set the stage for the global impact of this powerful substance. The Opium Wars were a pivotal chapter in the history of opium, marking a dramatic shift in its role and impact on global events. The First Opium War and the Second Opium War were primarily conflicts between China and Britain, driven by the British desire to continue their profitable opium trade. In the early 19th century, Britain faced a significant trade imbalance with China. The British imported large quantities of tea, silk, and porcelain from China, but China had little interest in British goods. To balance the trade deficit, the British East India Company began exporting opium from India to China. Opium quickly became popular in China, leading to widespread addiction and social issues. The Chinese government, recognizing the severe impact of opium on its population, attempted to curtail the opium trade, resulting in escalating tensions with Britain. The Chinese efforts to stop the opium trade culminated in 1839, when Chinese officials seized and destroyed a large quantity of opium in Canton. In response, Britain launched a military campaign against China, initiating the First Opium War. The superior British naval and military technology quickly overwhelmed Chinese forces. The conflict ended with the Treaty of Nanking in 1842, which imposed harsh terms on China, including the cession of Hong Kong to Britain and the opening of several ports to British trade, including the opium trade. The Second Opium War, also known as the Arrow War, began in 1856 over similar issues and resulted in further humiliations for China. The Treaty of Tientsin in 1858 and the Convention of Peking in 1860 imposed even more severe conditions, including the legalization of the opium trade and additional territorial concessions. The consequences of the Opium Wars for China were devastating. The widespread addiction to opium severely weakened Chinese society, economy, and government. The social fabric of the country was torn apart as millions of Chinese became dependent on the drug. The economic impact was equally significant, draining silver from the Chinese economy to pay for opium. Politically, the wars marked the beginning of the Century of Humiliation, a period of foreign domination and internal strife that profoundly affected China's national psyche. From the British perspective, the opium trade was a means to rectify their trade imbalance and generate substantial profits. The British government and the East India Company were deeply invested in the opium trade, viewing it as a critical component of their economic strategy. The opium grown in India provided a lucrative source of revenue, funding British colonial activities and sustaining their empire. The moral and ethical implications of the opium trade were hotly debated in Britain. While some British officials and businessmen defended the trade as a legitimate commercial enterprise, others condemned it as exploitative and immoral. Critics argued that the opium trade violated basic principles of humanity and justice, causing immense suffering in China for the sake of profit. The Opium Wars had far-reaching cultural and political ramifications. In China, the wars fueled anti-foreign sentiment and contributed to the rise of nationalist movements. The treaties that ended the wars were seen as symbols of China's subjugation and exploitation by foreign powers, fostering a sense of resentment and desire for national renewal. In Britain, the wars and the opium trade influenced public opinion and policy. The moral controversies surrounding the trade led to calls for reform and changes in British drug policies. The legacy of the Opium Wars also highlighted the complexities of imperialism, trade, and international relations, shaping British foreign policy in subsequent decades. The long-term effects of the Opium Wars extended beyond China. The conflicts and subsequent treaties opened China to foreign influence and trade, integrating it into the global economy. The opium trade itself continued to thrive for several more decades, with significant impacts on global trade patterns. In China, the legacy of the Opium Wars contributed to the eventual fall of the Qing dynasty and the rise of modern China. The wars exposed the weaknesses of the Chinese imperial system and prompted calls for reform and modernization. The experience of foreign domination during the Century of Humiliation deeply influenced Chinese political thought and policy, shaping China's interactions with the world in the 20th and 21st centuries. The Opium Wars were a turning point in the history of opium and global trade, with profound and lasting impacts on China and the world. They marked the beginning of a new era of international relations, characterized by unequal treaties and imperial exploitation. Understanding the causes and consequences of the Opium Wars provides critical insights into the complexities of history and the forces that shape our world. Following the Opium Wars, the trade and use of opium continued to expand globally. The 19th and early 20th centuries saw opium being integrated into various aspects of international trade, medicine, and even culture. The British Empire, leveraging its colonial holdings in India, remained a central player in the global opium market. Opium produced in India was shipped worldwide, with significant markets in China, Southeast Asia, and even reaching the shores of Europe and the Americas. The cultural influence of opium was also notable during this period. In Britain and other parts of Europe, opium became a popular remedy for a wide range of ailments. It was commonly used in the form of laudanum, a tincture of opium, which was readily available and prescribed for everything from coughs to pain relief. Notable figures, including writers and artists like Samuel Taylor Coleridge and Thomas de Quincey, openly discussed their use of opium, which influenced their work and the public perception of the drug. The late 19th century brought significant advancements in the processing of opium, leading to the development of more potent derivatives. In 1804, the German chemist Friedrich Serturner isolated morphine from opium, naming it after Morpheus, the Greek god of dreams. Morphine was hailed as a medical breakthrough, particularly for its pain-relieving properties. It quickly became a staple in medical practices worldwide, especially useful in treating severe pain and during surgical procedures. However, the widespread use of morphine soon revealed its dark side. Patients who were prescribed morphine for pain relief often developed a dependency on the drug, leading to widespread addiction problems. The Civil War in the United States, for example, saw many soldiers becoming addicted to morphine, a condition that became known as the soldier's disease. In an effort to create a less addictive alternative, chemists developed heroin in the late 19th century. First synthesized by C.R. Alder Wright in 1874 and later commercially produced by Bayer Pharmaceuticals in 1898, heroin was initially marketed as a safer, non-addictive substitute for morphine. It was used to treat a variety of conditions, including respiratory diseases and pain. However, it soon became apparent that heroin was even more addictive than morphine. By the early 20th century, heroin addiction had become a significant public health issue, prompting governments around the world to implement stricter regulations and controls on opiate drugs. The opium trade had profound impacts on the colonies and regions involved. In British-controlled India, the cultivation of opium poppies and the production of opium were tightly regulated by the colonial government. Indian farmers were often coerced into growing opium poppies instead of food crops, leading to economic and social disruptions. The British government's monopoly on opium production and trade generated substantial revenue, but it also fostered resentment and unrest among the local population. In China, despite efforts to curb opium use, addiction remained a persistent problem well into the 20th century. The social and economic toll of widespread opium addiction continued to weaken Chinese society, contributing to internal instability and resistance to foreign influence. The struggle against opium addiction became intertwined with the broader nationalist movements seeking to overthrow the Qing dynasty and establish a modern sovereign state. The early 20th century saw increasing awareness of the dangers of opium and its derivatives, leading to international efforts to regulate the opium trade. The Hague Opium Convention of 1912 was one of the first international treaties aimed at controlling the production and distribution of opium and other narcotics. This treaty marked a significant step towards the global regulation of drugs, recognizing the need for international cooperation to address the growing problem of drug addiction. In the United States, the Harrison Narcotics Tax Act of 1914 regulated and taxed the production, importation, and distribution of opiates and coca products. This act marked the beginning of more stringent drug policies in the U.S., laying the groundwork for future drug enforcement efforts. As the world moved through the 20th century, the focus shifted from opium to its more potent derivatives, particularly heroin. The heroin epidemic of the mid-20th century highlighted the ongoing challenges of drug addiction and the need for effective public health and law enforcement strategies. The rise of synthetic opioids, which we will explore in the next section, further complicated the landscape of drug abuse and regulation. Despite regulatory efforts, the legacy of the opium trade and its impact on global societies continued to be felt. The struggle to balance the medicinal benefits of opiates with their potential for abuse remains a critical issue in contemporary drug policy. The 19th and early 20th centuries were a transformative period for opium and its derivatives. The global spread of opium, the development of morphine and heroin, and the evolving understanding of addiction set the stage for the modern era of drug use and regulation. The 20th century saw the rise of heroin as a major public health issue, particularly in the United States. Initially developed as a supposedly non-addictive substitute for morphine, heroin quickly revealed its potential for addiction. By the mid-20th century, heroin addiction had become widespread, leading to significant social and economic consequences. In the 1960s and 1970s, heroin use surged in the United States, partly fueled by returning soldiers from the Vietnam War who had been exposed to the drug overseas. The availability of cheap, high-purity heroin led to an epidemic of addiction, particularly in urban areas. This period saw a dramatic increase in heroin-related crime and deaths, prompting public health officials and policymakers to seek solutions to the growing crisis. Efforts to combat heroin addiction included the establishment of methadone maintenance programs to reduce the harm associated with heroin use by providing a controlled, legal substitute. Methadone, a synthetic opioid, helped many individuals manage their addiction and reduce their involvement in criminal activities. Despite these efforts, heroin addiction remained a persistent problem, exacerbated by social and racial disparities. Fentanyl, a powerful synthetic opioid, was first synthesized in 1960 by Belgian chemist Paul Janssen. Initially used as an anesthetic and pain reliever, fentanyl is significantly more potent than morphine or heroin. Fentanyl's medical use expanded in the 1990s and 2000s, but its illicit production soon became a major concern. Fentanyl is often mixed with heroin or other drugs to increase potency, leading to a sharp rise in overdose deaths. The opioid crisis in the United States, which initially focused on painkillers like OxyContin, has increasingly centered on fentanyl and other synthetic opioids. The ease of manufacturing fentanyl and its analogs, combined with their high potency, makes them attractive to drug traffickers. These substances are often produced in clandestine labs and smuggled into the United States, primarily from China. The proliferation of fentanyl has led to a staggering increase in opioid overdose deaths. The modern opioid crisis has had devastating effects on communities across the United States. Overdose deaths have skyrocketed, straining public health systems and causing immeasurable pain for families and communities. The economic impact is also significant, with costs related to healthcare, law enforcement, and lost productivity running into billions of dollars. Communities hardest hit by the opioid crisis often face a complex web of social and economic challenges. Areas with high levels of poverty, unemployment, and limited access to healthcare are particularly vulnerable. The stigma associated with addiction further complicates efforts to provide effective treatment and support for those affected. In response to the opioid crisis, federal, state, and local governments have implemented a range of strategies aimed at reducing opioid misuse and its consequences. Key initiatives include expanding access to addiction treatment, increasing the availability of naloxone, a medication that can reverse opioid overdoses, and enhancing efforts to disrupt the supply of illicit opioids. One promising approach is the integration of medication-assisted treatment, MAT, into mainstream healthcare. MAT combines medications like methadone, buprenorphine, and naltrexone with counseling and behavioral therapies, offering a comprehensive approach to treating opioid addiction. Research shows that MAT can significantly improve outcomes for individuals with opioid use disorder, reducing the risk of relapse and overdose. Another critical component of the response to the opioid crisis is harm reduction. Harm reduction strategies aim to minimize the negative health and social consequences of drug use without necessarily eliminating drug use itself. Examples include needle exchange programs, supervised injection sites, and safe consumption spaces. These interventions can reduce the spread of infectious diseases, prevent overdoses, and connect individuals with addiction treatment and other services. Despite significant efforts, the opioid crisis remains a formidable challenge. The COVID-19 pandemic has further exacerbated the situation, with many communities experiencing increases in overdose deaths amid the disruption of services and increased social isolation. Addressing the root causes of addiction, such as economic inequality, lack of access to health care, and social stigma, is essential for long-term success. Innovative approaches and sustained commitment are needed to turn the tide of the opioid crisis. Collaboration between public health agencies, law enforcement, community organizations, and individuals affected by addiction is crucial. By working together, it is possible to develop more effective strategies, reduce the harm caused by opioids, and support individuals on the path to recovery. The modern opioid crisis, driven by heroin and synthetic opioids like fentanyl, represents a significant public health challenge. Understanding the complex factors that contribute to addiction and developing comprehensive, evidence-based responses are critical steps in addressing this ongoing epidemic. As we move forward, it is essential to continue exploring innovative solutions and fostering a compassionate approach to those affected by opioid addiction. Throughout this documentary, we've seen how opium's role has transformed over the centuries. It began as a powerful remedy for pain and other ailments, becoming an integral part of ancient medical practices. However, the dark side of opium emerged as its addictive properties became evident, leading to widespread misuse and devastating societal impacts. The British exploitation of opium trade exacerbated this issue, culminating in the Opium Wars that left a lasting scar on China's history. Today, the impact of opium and its derivatives is more profound than ever. The rise of synthetic opioids like fentanyl has brought new challenges, with overdose deaths reaching unprecedented levels. Governments, communities, and healthcare providers continue to grapple with finding effective solutions to address addiction and mitigate its consequences. The opioid crisis is a complex issue that requires a nuanced and multifaceted approach, integrating public health, law enforcement, and community support. The ongoing opioid crisis underscores the need for a multifaceted approach. This includes expanding access to treatment, implementing harm reduction strategies, and addressing the underlying social and economic factors that contribute to addiction. Innovation, collaboration, and compassion are key to making meaningful progress. The lessons from the history of opium remind us of the importance of balancing the benefits of medicinal substances with their potential risks, and of the need for responsible and ethical policies. As we conclude this documentary, we encourage you to stay informed about the opioid crisis and support efforts to combat addiction. Educate yourself and others about the risks associated with opioid use and the importance of seeking help. Advocate for policies that prioritize treatment and harm reduction over criminalization. Support organizations and initiatives that work towards reducing the stigma of addiction and providing resources for recovery. If you or someone you know is struggling with addiction, seek help from local resources and support networks. There are many organizations dedicated to providing support and treatment to those affected by opioid addiction. Together, we can make a difference and help those in need find a path to recovery. Thank you for watching. Please like this video, share it with others, and subscribe to our channel for more in-depth documentaries on important topics. Your engagement helps us continue to produce content that educates and informs.